Welcome back to the Cannabis Connection University channel, unabashedly brought to you by the University of New Mexico's Medical Cannabis Research Fund. And today I'm extremely excited to have an expert on a topic that is of tremendous interest to me because it affects a lot of the people that I know, and it affects a very important group of people that I'm doing my best to protect and help, and that is our American veterans. And the topic is post-traumatic stress disorder. This is one of the most widely used conditions for obtaining a medical cannabis license in New Mexico. And certainly this is a syndrome that has profound effects on many aspects of our bodily functioning, our mind and body, and our ability to give to other folks. And it is something that almost every single vet has some degree of experience with, and affects a lot of women in particular that have sexual trauma. So this is something that can really affect the human being in ways that can completely shut off their normal functioning. And today I have an expert on the topic, Bryan Krumm, and you are, well, I'll just have you describe yourself.
I'm a psychiatric nurse practitioner. A few years ago, I had a paper published in the Nurse Practitioner Journal. It takes a close look at what PTSD is. It talks about what happens in the brain and outside of the brain, the neurobiological processes that are involved, discusses the role of the endocannabinoid system in regulating those processes, and then talks about why cannabis is so much more effective at treating PTSD than pharmaceuticals.
I recently went to a psychedelic conference where I was learning about the potential of using different types of psychedelics for freeing the mind, breaking the mind of these canalized thoughts, the trauma that is sometimes revisited, and I got some really cool insight. And basically the theme was that using cannabis, or not cannabis, I mean, so folks have described cannabis as sort of a portal or kind of a lightweight psychedelic. Some folks have even described it as the most powerful because it allows you to engage in normal daily functioning while still expanding the mind. But the theme with those psychedelics was that presumably it allows folks to kind of see their trauma from a third person perspective where they're not reliving it over and over. So they're not seeing it through the mask of the victim, but seeing it perhaps more objectively, that presumably has some healing properties. But please, sir.
And with the certain entheogens, I don't have as much of a background on looking at the way that those might actually have it initiate a therapeutic response.
Okay.
All I can say is that we have the evidence that it does. And sometimes it's hard to argue with results. Where my research has been more focused on the actual neurobiological processes involved. And what happens with PTSD is that when we get exposed to something that's traumatic or threatening or dangerous in some way, we get activation in the emotional regulator in the brain, the amygdala. And the amygdala, when it senses danger, it turns on our stress response system, the hypothalamic pituitary adrenal axis. Now this starts pumping out stress hormones like adrenaline and cortisol and norepinephrine that put us into a heightened state of awareness, a heightened alert, a fight or flight mode, kind of thing. This developed a long time ago as a survival mechanism. And it used to be great when we were out looking for food and we knew a saber-toothed tiger was out there. It's nice to be on high alert with your vision tuned in and your hearing more sensitive and your heart beating faster, so you're getting blood to muscles that are tense and ready to respond, and your mind racing and watching everything going on around you.
Sure.
The saber-toothed tiger pounces out, you want to be ready to either run away or to fight it off. But in PTSD, this system doesn't turn off when the danger's over. And because we end up with these chronically elevated levels of these stress hormones pumping through the body and throughout the brain, eventually that can start to take a toll all over. But something we see happening in the brain itself is that this chronic bombardment of these stress hormones starts to cause inflammation. We start to see cortisol resistance, which cortisol is one of those stress hormones that it's a glucocorticoid steroid. And its job is to help kind of keep things from getting too inflamed. But when we start developing this cortisol resistance, it allows the brain to start developing inflammation. And that inflammation starts to cause certain structures in the brain to get smaller. So the amygdala, that emotional regulator, will actually start to get smaller, becomes less able to filter through emotional inputs and regulate those.
Okay.
We also see that the hippocampus will start to get smaller. The job of the hippocampus is memory storage. And part of what it is supposed to do is take bad memories and stick them way off in long-term storage. When the hippocampus stops storing these bad memories off in long-term storage, it keeps them up more toward the forefront. Something can come along in day-to-day activity that reminds the hippocampus of something that was bad. And so the hippocampus tells the amygdala, the emotional regulator, hey, there's something I don't like about this. Well, now the emotional regulator is supposed to take that information and find out if there's a danger. So it tries to ask the rational thinking part of the brain, hey, the hippocampus just told me something. Do I need to worry about this? But the lines of communication are down. The anterior cingulate cortex is the part of the brain that allows that communication from the emotional center up to the rational thinking parts of the brain.
Okay.
And those lines of communication are down because the anterior cingulate cortex is another part of the brain that starts to get smaller because of this chronic inflammation. And since the amygdala can't find out if there's a danger or not from what it was told, it just defaults back to, I better turn on the stress response system, and people are back in that fight or flight mode.
It's interesting that PTSD is characterized by this kind of, the startle reflex. A lot of the vets that I work with, they want to sit against the wall and face the room, and it's just a natural instinct. But the syndrome is also associated with just a shutting down of a blunting of emotionality in general. And from personal experience, I have experienced some of that, and it seemed as though the body shuts down so much when it's presented with an experience where there's a threat to one's life that it just never wants to go out in public again because it might encounter that. It was just so terrifying that the best response is this protective response, and then you have this blunted person that is having these ramifications on everybody that depends on them and their family and so forth.
And those are the things we look for in PTSD. We don't look for the type of trauma that somebody has been through. PTSD is about the physiological response that we see to stress. So we see that emotional numbing that will happen. We see the avoidance symptoms, people staying away from situations that might cause that re-experiencing. We see the re-experiencing, the flashbacks, the nightmares, the negative intrusive thoughts that keep going through. And we see arousal symptoms, the kind of hyper-arousal type of anxiety, waiting for that saber-toothed tiger to pounce out at any moment. All those different areas of the brain and the areas outside of the brain that are involved in the PTSD response, they are all regulated by the endocannabinoid system. And that's why cannabis is so much more effective at treating this than pharmaceuticals. Pharmaceuticals are designed to be very specific in how they work.
Sure.
And when you have so many different areas of the brain and areas outside of the brain involved in a disorder, you cannot be specific. So what we might do in traditional psychopharmacology is start with something that's FDA approved. So either Paxil or Zoloft or something similar, one of those SSRI antidepressants. And now maybe in about a third of patients, that's going to provide some benefits with some of the depression, maybe some of the general anxiety, but maybe there's still more anxiety. So now we add on another anxiety medication. Then maybe the anxiety is a little better, but you're still getting mood swings and irritability and anger. So maybe a
now
mood
you get
stabilizer.
side effects too, added side effects.
Oh yeah, then you can throw on something for the side effects, a new medication, and then still having problems with sleep, so something for sleep, and then something for nightmares that are coming up. And we keep just throwing one thing on top of another.
Sure.
And we've never studied these combinations of drugs together to see if they're safe.
Sure.
And all those different areas of the brain, they're regulated by the endocannabinoid system. So it makes sense that trying to address the endocannabinoid system is going to be a better way to try to address the treatment for this.
Absolutely. So pharmacologically, how would you explain how cannabis reduces symptoms? I guess there's a reduction of inflammation in the brain that might be impeding normative functioning morphologically.
Even more immediately than reducing inflammation, it regulates the amygdala's response. And it uses a negative feedback from that point to kind of shut off that hyperarousal system, the hypothalamic pituitary adrenal axis. You stop pumping out so many of those stress hormones, and that allows the body to start calming down again. One thing I don't always see the cannabis working as well for with PTSD is the depression.
Okay.
And as I said, the endocannabinoid system, it regulates almost everything in the body, including mood and emotional function.
Sure.
But part of what these cannabinoid receptors do to help with depression is when you activate them, either with the cannabinoids your body is supposed to produce itself or using the cannabis, those cannabinoid receptors need to tell serotonin where it needs to be in the brain. And just like with an antidepressant that targets serotonin, if we don't have enough serotonin in the brain, there's not enough of those cannabinoid receptors to work with. And that's the issue that we come up with in terms of serotonin, is that it won't cross the blood-brain barrier. We can't get serotonin into the brain by itself. There is a supplement, though, called 5-HTP. And it's actually getting, in recent years, they started looking at 5-HTP in addition to antidepressants for treatment-resistant depression. And what 5-HTP is, it's a serotonin molecule, but it has this extra piece attached. It's called a carboxylic acid. This carboxylic acid's really good at getting into the brain, and it will drag serotonin into the brain with it as 5-HTP.
Okay, sure.
Once this gets into the brain, vitamin B6 decarboxylates that, cuts off the carboxylic acid and turns it into serotonin once it's in the brain. So with this, we can start to increase brain levels of serotonin and saturate the brain with more serotonin.
Okay.
If you're taking an antidepressant, that's going to give your antidepressant more serotonin to work with. But more importantly, in terms of the PTSD, it gives those cannabinoid receptors more serotonin to work with. And unlike an antidepressant that we send that Zoloft into the brain to gather whatever serotonin it can find and hold it over here where it helps with the depression, you're pulling that serotonin away from other parts of the brain.
That's interesting.
And that's where we see a lot of these side effects that come up, because you're pulling the serotonin away from where it needs to be.
That's interesting.
With the 5-HTP, we start to saturate the brain with more serotonin. Then you're not seeing those side effects. It's a lot better tolerated than the pharmaceutical antidepressants. I've actually used this to help a lot of people move away from their pharmaceutical antidepressants.
Sure. And at least this is what I can say anecdotally, that 9 out of 10 vets, actually I think it's 8 out of 10 vets, say that cannabis helps with their PTSD. Of those two that say that it doesn't help, they say that 1 out of those two says that it helps with something else like pain. And 1 out of 10 vets who have tried cannabis proclaim that it hasn't benefited them. So that's a really low percentage. Now, you've probably treated thousands?
Thousands easily, yes.
Wow. And I know it's really hard to measure, even as a patient or a researcher or a medical provider, how and which cannabis products are most effective for different types of individualized treatment. Are there any broad experiences that you could kind of cluster together that can put some of that together for us?
People can respond differently from one strain of cannabis to another. The generalization I can say is that the majority of my PTSD patients find that indica strains tend to be a lot more calming, more relaxing, more sedating, especially at nighttime, help them sleep more, help them stop the racing thoughts. Indica strains, though, might cause a little too much sedation, too much couch lock during the day.
Okay.
So people have sometimes a hard time functioning with an indica during the day. In that case, something like a sativa, which is typically a little bit more uplifting, more energizing, might be helpful. But the problem with sativas is that for some people, they're more likely to cause some anxiety, paranoia.
Sure.
Some people get that from an indica also, but I see it a lot more frequently with the sativas.
And of course, we're left with only indica and sativa because we haven't been allowed to do the research to actually figure out which chemovars, which chemotypic profiles and clusters of chemicals are effective for A, B, and C. And we're left with these labels, indica, sativa.
Well, to a certain extent. We do have some research showing different strains of cannabis and what type of terpene profiles that they have. And there are a few, very small number of cannabis strains that have their own unique terpene profiles. Kush is one of those varieties of indica that separates out from the other strains of indica with its own unique terpene profile.
Okay.
And a lot of my PTSD patients seem to be drawn toward the Kush strains.
That's interesting. I don't know if you're aware, but we're working with the largest database in the United States of real-time effects of cannabis use through our partners at the Relief Lab. So I think at this point, we have over 250,000 real-time sessions, cannabis use sessions, where people are indicating the products and the effects immediately. I'm going to look at our data with regard to Kush and see if there's something interesting, first of all, with regard to the clusters of terpenes that are associated with it, and then if it might have some particular effects on patients. So that's really interesting to point that out.
Blue Dream is another strain that separates out in terms of those terpene profiles. And a lot of my patients who can't tolerate indica during the daytime, they find that the Blue Dream works pretty well. I've had people describe Blue Dream as a sativa dominant strain that acts more like an indica.
Yeah. I've
And
had experience with Blue
yeah.
Dream, and it really elates the mood and just puts you in a great spirits.
Another strain I see that or that had its own unique terpene profile is one called Green Crack, which is a really strong sativa,
Okay.
and that's a strain that a lot of my PTSD patients find causes a lot of anxiety, a lot
Okay.
of paranoia with. However, conversely, that a lot of my patients who have attention deficit disorder seem to really be drawn toward Green Crack. That's
Okay.
more of a stimulant kind of an effect.
Not
So,
real practice.
yeah, but that
cannabis
particular strain, that's another one that separates out. And then Harlequin, which is one of the high CBD strains, also
Okay.
separates out. But most of these um, cannabis strains, they kind of share a general cluster of
That's what we're
different
finding.
terpenes.
Yeah, it's really hard to distinguish them, and it seems as though they just generally affect our bodies in this way, all kind of together, and there doesn't seem to be a lot of individualized in these outcomes that we're observing thus far. Now, I know that a lot of the vets are resistant to experiment with cannabis because they're in fear of losing the right to defend themselves, losing their rights as a patient at the VA, and I haven't had the best experiences working with the VA personally. But what can you tell folks that are taking piles of pills out there and are still resistant for many different reasons? And again, we're still living under this stigma. We all grew up with people pointing fingers at cannabis users and speaking to them in derogatory terms and stigmatizing anything that has to do with cannabis. That's why we have these special terms: stoner, doped up. These are really negative things. Getting high is a negative thing. It's subjective well-being, but getting high is a negative thing. What can you tell these folks that are still resistant to take full control over what they put in their body?
Well, in terms of the VA system, a friend of mine, Michael Krowitz, many years ago, he forced the VA to change their policies so that VA patients who are in a medical cannabis state cannot be denied needed medical treatment through the VA if they're using cannabis
I don't
legally
think
in
a
the
lot of
state.
patients know that, and they get a lot of resistance. I hear it from them. My provider told me explicitly. Some of them have told me that their providers were sent memos, and they've shown the patients those memos that you cannot speak highly about medical cannabis. So,
And their providers are not allowed to speak about this, just like at UNM. The UNM Psychiatric Center, it wasn't all that long ago that the psychiatric providers there were being told by administration, you cannot talk to your patients about medical cannabis.
wow,
We
that's
don't
amazing.
recognize this. You can't refer them to the program. We don't even want you to talk about it, or you will be reprimanded.
Sure.
And that violates First Amendment rights, in my opinion.
That's
I
interesting.
mean, doctors have a First Amendment right to free speech. It was upheld at the Supreme Court in Conant versus Walters when the DEA was trying to come down on the doctors who were referring patients into the medical cannabis program when California's program opened up. And the Supreme Court said, no, doctors have a right to talk to their patients about this. Unfortunately, we have hospital administrations that deny doctors that constitutional right.
Wow, that's amazing. It obviously goes against the oaths that they've sworn to uphold. So, in terms of advice to these patients that are still a little resistant,
Um, Look at the research. If you go to my website, harmonypsych.org, and click on the patient information section, the very first link in there takes you to a paper that I just put in there about the use of cannabis for treating COVID-19.
okay,
But the second link in there takes you to that paper that I had published in the Nurse Practitioner Journal on the use of cannabis for treating PTSD.
excellent.
Take a look at some of those other links in the patient information. I've got links to really good resources about medical cannabis. And ultimately, you've got to educate yourself about this if you're going to feel more comfortable with being able to use this.
And I think you would agree with me that taking full control over those decisions is ultimately in your best interest. I don't think that there are a lot of forces out there that are protecting us. We need to protect ourselves and each other.
And we need to be our own best advocate for our own health care.
Sure. Thank you very much, sir. I appreciate it.
You're quite welcome, and thanks again for having me.